So I just want to thank everybody for coming out this morning. To see a few of our council colleagues here, Councilman Ramos from the north, Councilman McGyver from the Central Ward, Councilman Osborne here with us today. I want to thank them for their support, their interest and commitment. And Councilman Ramos has been helping us on two levels, one as a councilman and one also as the county, making sure that we deal with the residents that are there in our shelter. The city of Newark has traditionally responded to homelessness, particularly sheltering homeless individuals or unsheltered individuals during two specific times of the year. One, when there's a code blue, and again when there's a code red. Obviously, this winter was long and crazy, so we extended the shelter opening for the code blue longer than we normally did. We did the same for the code red. We were able to keep the shelter open. The shelter was supposed to close in March. We were able to keep the shelter open because of a few of the organizations here, also because of CDBG dollars, but also because of United Airlines, PSE&G, RWJ Barnabas Health, New Jersey Devils Prudential, and University Hospital came together as corporate partners, gave us additional funding to be able to keep the shelter open through the month of July and now August. We're continually going to continue to raise money to be able to support the shelter as much as we possibly can. We also put out an RFP that I'm going to allow Dr. Wade to get into more detail about that talks about the strategy that we're going to use going forward, which is basically to support the organizations that have been doing this work for over 15, 20, 30 years or more, sheltering the unsheltered population in this city, beginning to give them resources, finances to expand the number of people that they are able to see, to get more beds that they have, because ultimately the city wants to support them, and we don't want to do it ourselves. We want to be a part of a larger community who has been doing this work, by the way, been doing a great job at it for a very, very, very long time. There are some things that I'd like Dr. Wade to talk about that the city has been very, very successful at in mitigating this homeless situation and even pulling people out of homelessness that we as a city are going to focus on more consistently and begin that process as well. We also visited these container homes that were put together by Central High School students for folks that have been victims of disaster. We are going to take that and begin to duplicate those and use it for our homeless population. We are putting together a strategy, a plan for that, and we'll be going to our partners and other folks to help us develop this out for transitional housing for our homeless population. I do want to say, since we opened the shelter in December 2017, we have witnessed 30,804 bed nights total since the opening. About 2,363 bed nights in July, and 238 unduplicated persons in July, meaning we had 238 people who came in there at least once who were not duplicated. We had 2,203 since reopening on July 5th. The highest count on 7/19 was 150 residents. The unduplicated client count was 336 since December 13, 2017. So we saw 336 homeless individuals at least once, who were not duplicated. Rutgers Behavioral Health visits the facility on Tuesdays and Thursday mornings. We have a medical van that comes there as well. The county has been helping us continuously and consistently, even more lately, to begin to place a lot of these residents either on welfare or other resources or opportunities that the county has. So we are also putting together a homeless coalition that once existed. There is a homeless coalition that exists, a homeless commission that once existed. We're putting the homeless commission together to begin to look at all of these issues and figure out how we can mitigate the homeless problem here in the city of Newark. I would be remiss, and I know Dr. Wade is going to talk about it as well, to not mention Housing Authority Director Victor Cirillo, who's been with us consistently in helping us do this. In fact, helped us secure housing vouchers for some of the residents who will now be in permanent housing because of the housing vouchers that were secured through the DCA and the advocacy of Victor Cirillo, Director of the Housing Authority. So that being said, I'll let Dr. Wade put some meat on the bones here.
Good morning. Just to add to what the mayor has shared, this emergency shelter that's now been open for 7 months was just to meet an emergency need. But the heart of the city, the vision of the mayor, is to not pass a baton, but to lock arms with the shelter providing community who have been doing a yeoman's job for decades. So, though this shelter has essentially addressed 3/4 of the unsheltered homeless that you see out on the streets, we now want to expand the capacity of the sheltering community. Those shelter programs, there are 59 in the county, there are 31 in the city, expand their capacity by providing the funding for them to see these individuals who are on the street because they could not gain access to current shelters because there was no reimbursement for those shelter programs. The city now wants, again, to support those who've been doing the work by expanding their capacity with finances so that together they will have the resources to bring those who are on the streets inside into a safe environment. The work that we've been doing since the opening of this shelter and really focused over the past 2 months has been the following. Our initial response in need is to get those individuals who are in the shelter out into a secure housing location, get them jobs, et cetera. To accomplish that, the state, through the New Jersey Department of Community Affairs, the county, through its Continuum of Care, who have been a yeoman's partner in doing this work, Victor Cirillo and the Housing Authority, the Department of Health and Community Wellness for the city, have come together and really formed a seamless work team to address these residents. As a result of that work, we have collectively identified approximately 45 housing opportunities for individuals who have a dual diagnosis of chronic homelessness and severe mental illness. So there are locations identified, and now as we move those individuals into those housing, that's permanent housing for individuals with such a diagnosis. It takes a little bit of time, but we're working and we have those slots identified. The next group, in order to get housing traditionally, like Section 8, et cetera, you have to have income. To have income, you have to have a job. So we've been really focusing on providing job opportunities for these individuals. Through the leadership of Victor Cirillo, the Housing Authority availed 25 job opportunities if an individual is willing to do construction and could pass a drug test. So the Housing Authority made a presentation at the shelter about 2 weeks ago. 32 individuals showed up for the presentation and 11 qualified for jobs. The city's Workforce Development Division came and made a similar presentation last week. 36 individuals who were in the shelter showed up for that presentation. 12 were offered jobs. The mayor initiated at the beginning of the summer a mayor's 100-day work program for the homeless. 50 individuals, 23 of which were from the winter shelter, if you will. Of those 23, because they now had income, 15 of them were able to secure housing on their own and no longer live in the shelter. So it really speaks to how important it is for these individuals to have jobs and why our focus now is so deeply rooted there. Other activities that we are involved with, we are releasing an RFP for sheltering going forth. It will be very different than we've done heretofore. This will be a year-round sheltering responsibility that will not be for just one entity. It will be for a multitude. Our goal is to have many providers providing this service. And again, it's providing the finance for them to address this specific population, those who are on the street. Okay? That's going to be released on Tuesday, the 31st, and the following week, that Monday the 6th, 9 a.m., we'll have a Q&A for potential responders, and the 21st of August, the bids will all be opened, and we go forth from there. Nextly, as the mayor mentioned, we are reestablishing a homelessness commission, or Newark's Commission on Homelessness. It's going to be a commission that has essentially three large groupings. One is the corporate and business sector that can bring that thought leadership and hopefully resources to Newark. The second group, which is really the meat and potato, are those who actually do service provision. So these various service providers and those who provide the supportive services will be a key component of the commission. And then the third component will be a cadre from individuals who have themselves been homeless to our academic community, et cetera. So we wanted to bring as comprehensive a group of thought leaders that will help guide the city in its movement to reduce and eliminate homelessness in Newark. We also have gotten, Rutgers Business School has extended an invitation to help the city develop a business plan, which would include a financial plan for addressing homelessness in Newark. So we're really excited about that partnership that we will receive from the Rutgers Business School. We have, as the mayor mentioned, we've already started the investigation of container homes as one of the possibilities. We're going to be researching trailer homes. We just want to make sure there's no stone unturned in terms of the possibilities for providing housing for those who find themselves homeless. We also have been engaging various national organizations who have documented, demonstrated successes in helping cities across the country like Miami, Chicago, Detroit, and even counties like Bergen County here in New Jersey to be successful in dramatically reducing homelessness. So we want to partner with national strategies and thought leaders that can help us get across the finish line quicker. So there's a comprehensive approach that the city is taking. We are in no way trying to do it ourselves. The mayor's vision has always been working in partnership. So this very important opportunity to address the needs of the homeless gives us another chance to demonstrate how the benefit and the effect for the community as we work together.